Friday was just another ordinary day. Last day of the week for me working, because I worked as a district nurse. I'd come home and I was just sitting down to my cup of tea, and then I looked out the door and I could see Matt coming in from outside, and he was walking towards me holding onto his right hand side and sort of leaning into it, and I looked at him and I thought, appendix. It didn't look good, so I thought, well, let's go up to the hospital and check this out. And that's where it all started. He went straight into A&E, and he was seen by the surgeon on call that night, and he confirmed he had appendicitis and that we should, take it out that night. The appendectomy went well, and then between theatre and recovery, Matt had laryngospasm, so he'd stopped breathing. So they bagged him, gave him reversal agents, and got him into the recovery room. And it was taking quite a while. I was waiting outside recovery, so eventually they came and got me and brought me in.
How you doing?
And told me what had happened. Matt, he was obviously breathing, but he was very angry, and they're having trouble calming him down. And then Matt coughed up some pink froth into his mask, and I just watched the nurse wipe it out. So I said to the anaesthetist, did you see that? And her answer was, it's probably just trauma from intubation. Why would I question what she's telling me? Because I'm concentrating on calming him down and just being there as his mum. After that, they called the nurse from the ward to come and get Matt and take him back to the ward because they felt that he was good to go. I asked Matt to go into the kids' ward because he wasn't yet 16, and they had TVs. But I did it on the understanding that if there was any complications or any reason not to go to the ward, then that's fine, we wouldn't go there. But the ward is where we went. Once we got Matt settled into his room, I kissed him, told him I loved him, and I said in the morning. He'd calmed down by then. And I remember looking at the couch bed thing beside him and thinking, I could stay there. And but he wasn't in the mood for that. so I just went out his room and I said to the afternoon nurse, look, I'm not comfortable. Where are you sitting? So I checked her. And she told me she sits at the desk right outside his room. And I also said, look, I want you to keep him on a monitor all night and ring me for anything, or even if he just wants to talk to me, give me a call. So I went home. We got the phone call about 6:30, 6:40 on Saturday morning. Dave answered, and the nurse said to him, Matt has respiratory arrested. And Dave had no idea what that meant. But I remember him saying...
Did you want us to come in?
So I took the phone off him and asked what happened. They told me...
What's happening? It's not breathing.
That was it. I just jumped out the bed, and Dave's still looking at me wondering what's going on. I said, Matt isn't breathing.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
And when we got to his room, they were still bagging him. And the doctor, the anaesthetist, the nurses were all either working on him or standing around. And I couldn't believe it. He'd already had a lot of medication given when you resuscitate people. His pupils were really dilated, so at that stage we didn't know, was it from the medication that he's been given, or has he lost a lot of oxygen to his brain? We're unable to tell, because that looked really bad if you look at it from a nurse's perspective, but from a mum I could see they were giving him an oxygen, but he was breathing with that oxygen and he had a pulse, so he was still there. Then we took him on his bed down to ICU, and the doctors were talking with the team in Christchurch about what had gone on and what's the best things to do for Matt, so they sent a retrieval team for Matthew on the plane. It took a long time to stabilise Matt. Every time we moved him, we were just trying to get x-rays to see what was going on with his lungs. His oxygen saturation would just dive. And then it took about 8 hours to get him stable enough to be able to move. So at that stage the doctor took us into a room and talked to us and said, look, Matt's got a 5% chance of living. I'll take that chance from his mum. We transferred him to the plane, got him up in the air, and it was the most stable he'd been the whole time. He was amazing. Over the following days while we were in ICU, there were a lot of different specialists came in, and they'd stand at the end of his bed and look at Matt. They'd look at his notes, and then they'd leave, and you wouldn't really hear what was going on. He was connected to every machine going. He was on dialysis as well. Still just trying to get him stable. It was a few days before we were able to get him to an MRI to see what was going on with his brain. Seeing Matt lying in bed was devastating, because it's not Matt. Matt never was still. He was always on the move. He loved mountain biking with his friends. They built their own tracks as well. Telling him he couldn't do something was like a red flag to a bull. He enjoyed life, tried everything, and he didn't really care what anybody thought. And then the MRI, we got called into the lead doctor's office, and he told us how bad it was. Matt had no oxygen to his brain. So he was being kept alive just on the machines. He wasn't going to survive. So said once they turned the machines off, he would pass. But I still wasn't ready. I don't think you're ever ready. So I said, just give me one more night. Not ready. So we did. So we got one more night with him. And I remember asking the nurse, the amazing nurses, saying I'd love to just lay beside him all night. So she's great. She said, I can fix that. And she went round to the side of Matt's bed. She pulled him over to the side and made room for me. So there you go, sit there. And I did. So I got to hug him all night, and it was wonderful. It was worth so much to me to be able to do that. And then the following day, with a lot of family around, very close friends, they turned the machines off, and I looked at the monitor for a bit. It was slowing down, and I just gave Matt a hug. He had the air on his heart. I just listened to it slow down till it stopped beating. There you go. Yeah, it was the hardest thing I've ever had to do in my life. After Matt died, I was still pretty much a zombie, so it took took a while to function properly again, but I was really lucky. I have amazing family and friends, so I've always had support. I was really lucky to have that support. I had contact with Karen Belsfield from the hospital. She was Director of Nursing there, and she kept me up to date, you know, because I remember saying to her, just find out what happened. That's all I want. Find out what happened.
Hello, Karen speaking. As a DHB, it's really important to take accountability when something's gone wrong. I was part of the team that reviewed this case, and you speak to people involved and get an overview of what had happened over that time, and you review the clinical file and pull it all together and get an overview and a picture of what actually had happened over those hours. It's to understand what went wrong and what were the systems and processes that weren't quite right or that may have contributed to the outcome.
There were a lot of reports that came my way because I wanted to see everything. I wanted to make sure that they were doing everything they could to find out what happened. I had 4 different specialist anaesthetists reports, police, coroner, hospital reports. I don't know, they seemed to be never ending. But I just wanted to make sure I did everything that I could for Matt to find out what happened.
Heather has every right to be angry about this. Matt should not have died. When Matt returned from theatre to recovery, he had a laryngospasm. And what we know, following the investigation and the coroner's inquest into it, was that he developed negative pressure pulmonary oedema. And what that leads to is an accumulation of fluid in the lungs. And that is easily reversible. It is treatable, and there were points during Matt's 12 hours post-operatively where it should have and could have been identified that was happening, and it could have been treated. What we decided after we'd been through everything was that there were a series of things that may have contributed to the outcome for Matt, and as a result of that we developed a long list of recommendations to improve our systems and processes.
What became clear through all the reports that I read was there was huge lack of communication between everybody involved, really. They missed a lot of symptoms. There was a lot of indicators there that was, showing what was going on. But laryngospasms happen, but that doesn't make it normal. And that's what they'd done. They'd normalised the abnormal. And then they didn't use any critical thinking. Matt, just a few of his symptoms, he was angry, he was extremely angry. So, was he hypoxic at that time? Possibly. He was being given really high flows of oxygen, 8 to 10 litres a minute, and he was only saturating at around 92%, and sometimes that was dropping even lower. And this is a really fit, healthy 15-year-old kid who, even in A&E when he was in pain, was still saturating at 100%. He coughed up pink froth into his mask. So, what was going on at that time? So nobody put any of those things together, and they put him in the ward. So what happened during the night? How many times was he alarming? What happened when it alarmed? Matt started snoring during the night. Matt doesn't snore. I've never heard him snore. I know the nurse won't know that, but I know that's an unusual symptom, especially when it's really loud snoring. But, if he is, why not check on him? What was happening? So there was a lot of indicators there, but nobody was putting 2 and 2 together. And Matt paid for that with his life. There you go. Obviously I've been through a really hard time in my life, and as is all my family. But, the most important thing to come out of it for me is to encourage other people to speak up, and for health professionals to realise how important it is to communicate and to be an advocate for your patients. Because I strongly believe if people had communicated and really looked at what was happening with Matt, he'd still be alive today. And I want to stop that from happening. And all it takes is just communication. That's the biggest thing I can say. Communicate, and most importantly, work together as a team. Use critical thinking, never normalise the abnormal, and listen to your gut feeling, because if something doesn't feel right, then it probably isn't right. Check it out. No question's a dumb question. Just working together, that's like the most important thing. I mean, I had two choices when this happened. I could crawl up in a ball and just forget about life, but actually it wasn't a choice for me, because I had a husband, I had 3 kids that that I loved very much. So my only way forward was to fight, and it made me a stronger person because of it. Not because it was ever something I wanted to do, but something I had to do.
Heather's story isn't about naming and shaming and blaming, actually. It's about 4 key learnings that are applicable to any clinical practice. And we like to stress those 4 key learnings. The first is, don't normalise the abnormal, because there are dangers in normalising the abnormal. Theatre teams do see laryngospasm all of the time, but actually it's not normal for the patient. So the risks of normalising the abnormal are quite important to remember. The second thing we talk about is documentation, and clinicians get tired of hearing it. Documentation is important because it helps us think through what might be happening for the patient. It also gives us a clinical picture in its entirety down the track if we want to come back and review what might have happened for that patient in that moment. The third point is the importance of critical thinking. It's important that all of the time we're thinking, what might this mean? What's going on for the patient in this moment? Then engage your brain. Don't assume that just by completing the documentation your job is done. You need to constantly be thinking, what might this mean for the patient? And the final key learning is speak up. And speaking up is not just about enabling and empowering a more junior staff member to challenge and question a more senior clinician. It's actually about enabling anybody in that moment to speak up, and part of that is listening to the patient, listening to the family, and listening to our colleagues, because that questioning can be really important.
Go!